Dandruff causes, symptoms, and treatment. Introduction. Dandruff is a common scalp condition that causes flaking of the skin and sometimes mild itchiness. It is not serious or contagious, but can be embarrassing and difficult to manage if persistent. With proper care, dandruff can usually be controlled effectively. Causes of dandruff. 1. Dry skin. Most common cause, especially in winter. 2. Oily scalp and seborrheic dermatitis. Greasy, irritated skin leads to white or yellow flakes. 3. Fungal infection, malassezia. A yeast-like fungus naturally found on the scalp can grow excessively and irritate the skin. 4. Poor hair hygiene. Infrequent washing can lead to oil and dead skin buildup. 5. Sensitivity to hair products, contact dermatitis, allergic reactions to shampoos or dyes. 6. Stress and hormonal changes can worsen dandruff. Symptoms: white or yellow flakes on the scalp, hair, shoulders, itchy scalp, dry or greasy patches on the scalp, in severe cases, redness and inflammation. Diagnosis: dandruff is typically diagnosed through a physical examination of the scalp. No special tests are usually needed unless another skin condition is suspected, like psoriasis or eczema. Treatment: 1. Medicated shampoos, anti-dandruff shampoos, containing active ingredients like zinc pyrithione, ketoconazole, salicylic acid, coal tar, selenium sulfide. 2. Home remedies: tea tree oil, natural antifungal, apple cider vinegar rinses, aloe vera for soothing. 3. Proper hair care: wash hair regularly with a mild shampoo, avoid harsh chemicals and hairstyling products. 4. Lifestyle tips: manage stress, maintain a healthy diet, stay hydrated. When to see a doctor. If dandruff doesn't improve with OTC treatments, severe itching, redness, or hair loss, signs of infection or scabbing on the scalp. Conclusion: dandruff is a manageable condition with the right care and treatment. Using the correct shampoo, maintaining good scalp hygiene, and addressing underlying causes like dryness or fungal overgrowth can help keep flakes under control. If symptoms persist, consult a dermatologist for a tailored solution.